Your Eminence, Reverend Fathers, Frank and Helen, and friends in the congregation. I've just been asked to ask people at the back if you'd like to move forward. Join the body of the Kirk, as we would say in Scotland.
Well, the mic is right there too, so we can
So it's a real pleasure, it's an honour for me tonight to be speaking for the Canadian Catholic Bioethics Institute and in conjunction with the Newman Centre to give this short lecture in honour of Frank and Helen Morneau, who have been and still are wonderful contributors to our institute and to the Newman Centre. And there is so much about Frank and Helen that I don't know. I just heard tonight about their very deep involvement in Newman over the years. There's just so many layers of work, etc., contributions they've made in so many different ways over the decades, and that's really very interesting for me to know that too. And so it may seem strange to do a little lecture in somebody's honour, but CCBI is about research and education, so we thought that that would seem appropriate to do that. And tonight's topic, when I was thinking about what to talk about, it did dawn on me that we talk a lot about the virtues, of course, and I've never really linked them so directly with bioethics before, so I thought it might be an interesting exercise. And it does link very much with the readings tonight and with the Cardinal's homily about knowing ourselves, about who we are and who we are before God. That's really what virtues are all about. So that's the reason. I think it was advertised in the Catholic Register that it was about conscience. But if you did find out what the topic was about from elsewhere, it's about the cardinal virtues and bioethics. Conscience is part of that, so it's really not so far off. So we know that bioethics is a growing area and there are many different perspectives on it, both religious and secular. And as Catholics, we have a distinctive way of looking at the ethical questions that are raised and a distinctive way of framing our responses. And we look to church teaching for those responses. And at the same time, we're motivated and guided by the theological virtues, the really important virtues of faith, hope, and charity, which can set us on a different path and approach to human life issues. But we also look to those habits of living well, those that are capable of being achieved by any of us human beings, called the virtues. And we all experience and practice these to different degrees, and we recognize them in others. For example, patience, honesty, helpfulness, kindness, hospitality, generosity, selflessness, humility, diligence, and so on. It's an almost inexhaustible list. Over the centuries, the Catholic Church has developed a fairly large body of teaching in ethics relating to care of the body as well as care of the soul. And this continues to grow with the possibilities raised by developments in research and in biotechnology, areas that have implications not just for bioethics, but for broader areas of sexual ethics and marriage, parenthood, and the structure of the family itself. And bioethics also deals with essential and everyday questions in ethics, such as birthing and dying, as well as moral decision-making as to when to begin or to give up some medical treatments. For example, there may come a time when a person decides that he or she no longer wants to continue dialysis after persisting for years. There are times when people decide they no longer want to be kept alive on a ventilator. Someone may abhor the prospect of long sessions of chemotherapy. Catholic teaching does give guidance in these areas, but it is truly at the level of guidelines, although there are some principles involved, including the most basic principle of respecting the dignity of human life from conception until natural death, a principle which is increasingly, as we know, under attack from both within and without our church. We know that since we are dealing with individual situations and individual lives, decisions cannot be made by ways of policies or checklists, nor are there guarantees that all our decisions will be 100% accurate. I think this comes as a shock to some people who think that the church has every last situation covered. And it also comes as a shock to those who think that the church teaches that life must be preserved at all costs. It does, of course, insist that life must be preserved and that life must not be deliberately terminated nor death hastened. Once we recognize that there are nots, that some actions are wrong, we are also saying that those actions go against human reason, although those words sound rather gentle. We say to each other, don't be unreasonable, and we just mean, please talk sense. But the longer tradition of the meaning of the phrase in Catholic teaching is that if something goes against reason, our highest human faculty, it is wrong and should not be done. And this brings us to the question of how we know that something is against reason, and it's here that we can bring in the 4 cardinal virtues: prudence, justice, fortitude, and temperance. I think to some people it sounds like an unlikely list, but I would like to show how these virtues help in making moral decisions in every area of life, and therefore for our purposes tonight, in bioethics especially. And these 4 virtues were not invented by the Catholic Church, although it accepts and promotes them. Philosophers came to these conclusions over 2 millennia ago in studying human nature. And they found that while there are clearly many, many forms of human enhancing behavior, which we call virtues, there are 4 major groups without which all these behaviors cannot be virtues. So we call them fundamental or major virtues, but the ancients used the word cardinal from the word cardinal, meaning a hinge. That is, all the other virtues hinge on these 4 virtues, which are essential to all the others, just as a door cannot function as a door without its hinges. Our cardinal is called that because he too, so to speak, is a hinge. The Pope needs the cardinals in order for the church to function properly. The listing is important. They are always listed in that order: prudence, justice, fortitude, and temperance. And I'm going to try to explain briefly the reason for this and then show them in application. The main reason they're so important is that they are or can be characteristics of us as people. So when we have to make moral decisions, if we have these virtues and exercise them properly, we're more likely to make good moral decisions. They're very important for conscience formation, although sometimes forgotten. It's probably safe to say, though, that we all possess and exercise these cardinal virtues. Perhaps we do not see that we do, or maybe do not name our decision-making process in that way. Is that not clear enough?
I'm so sorry, Moira. I want to hear every word that comes out of your mouth.
I hope my husband agrees with that. Sorry if I didn't hear that before, but to me it sounded pretty clear. So, the first cardinal virtue, prudence, it's sometimes called the queen of the moral virtues, and yet it sounds unlikely. It's an old-fashioned word to many people, sounding more like the way a very cautious and timid person would operate. But in fact, it means the capacity to see reality as it really is and to make wise and sound decisions. Prudence has to do with practical application, and in some ways it's another word for an alert conscience, that inner prompting that leads us in our decision making and in our assessments of what is right and what is wrong. Now that doesn't sound too difficult or far from our experience. Yet knowing and assessing reality, what is actually going on in any given situation, can be difficult. For example, when someone is ill and a doctor gives a diagnosis, the person sometimes gets mixed up in recounting exactly what it is the doctor said. The person even sometimes forgets. While we may be very sure of the price of the bag of milk that we bought just before we went into the doctor's office, we know that when our emotions come into play in areas where we are personally and deeply involved, we may not be able to think as clearly, and those emotions can distort reality for a time. We've all heard of denial and how it can take some time for the truth of a situation to be completely accepted by someone. And in those situations, some real harm could result if it takes a person too long to reach that stage. We probably all know of relationships where one person has turned a blind eye to the other's behavior. Perhaps the person drinks too much. but has convinced himself or herself that the other will reform once they are married. When we do not want to see something, we will often not see it, and the truth, when it dawns, will hit us like a bolt of lightning. Why did I not pay attention? What prevented me from seeing reality? If we have been deceived, that's another matter. But when the truth was there and we ignored it, then the fault was our own and we were not prudent. So prudence is the ability to be clear-sighted and truthful, to be open to the facts of the situation and to pay attention, to investigate further and to ask further questions, to try to perceive consequences of a given way of acting, both in the short and long term, to have the ability to put 2 and 2 together and only come up with 4, to make judgments built on reality and to assess a situation accurately. Prudence considers not just the end or the goal we have in view, but also questions if the way we achieve that goal is right in keeping with reality. And as we most often say, the ends do not justify the means. For an action to be right, the means must also be right. I think we can see that prudence is the hallmark of mature persons, regardless of age, developed through practice and experience. It's a habit, a way of looking at the world that depends on critical and evaluative thinking and experience until it becomes part of our makeup. People we call wise are usually prudent. Truly brilliant people can do some truly stupid things, but wise or prudent people rarely do. And a person doesn't need to be incredibly clever to be prudent, which is reassuring. But we do need to use our reasoning power, and that's what's behind this virtue, using reason in the right way. In bioethics, in making some medical decisions about treatment, as I mentioned, we can see that the ability to see the reality of any given situation will help us make good decisions. Of course, this may not happen instantly, but we do need to keep our wits about us, as we say, and not panic. We need to be able to see, or we need to have pointed out to us when we're not seeing things straight, when our emotions are leading us, and when we are grasping at straws. I remember, and it's sad to remember, an acquaintance who rejected chemotherapy, and that might have been morally justifiable. But her reason was that radiation can kill you, which is true, depending on how given and absorbed, but not in cases of radiation therapy. And also that she'd heard that some kind of shark oil offered protection or a cure for cancer. And this was not in the least evidence-based, and she was an intelligent person. And to me, this did not make sense. It was unreasonable and imprudent. It was not based in reality. Now, if she had been offered a 50% chance of survival after an arduous course of treatment, treatment which she dreaded, her decision to reject treatment could have been reasonable for her and therefore prudent. Another important area for the practice of prudence is at end of life, where questions of beginning, continuing, or withdrawing treatment are frequently raised. Catholic teaching, as I said, says we do not need to preserve life at all costs, and therefore we have to assess every situation carefully to see what the reality of that particular situation is. And when people have to make decisions for someone else, it's in some ways even more difficult. And I'm sometimes reminded of this in parishes with our People in the Pews program, because there people often speak publicly or privately about the end-of-life decisions they had to make for a husband, a wife, or a parent. And in listening to their explanations, they often say they sometimes still feel a little guilty when the person dies. Excuse me. I don't usually drink water in churches. But then, when they've said that, I hope it helps when we reframe the issue. And I say, I think, perhaps they are experiencing what's a very normal concern about those decisions, and it is no wonder. They literally had someone's life in their hands, and that is an incredible responsibility. Thomas Aquinas' statement about anxiety is very reassuring here, because he said, "The certitude of prudence cannot be so great as completely to remove all anxiety." As I said, that idea that we are never 100% sure, but we always have to act to the best of our ability. So just as in conscience, the first thing prudence demands is that we be clear about the factual situation, the reality, the objective truth of the situation, regardless of our perspective. And where we will find that sort of information, that factual information, can vary. If I want to know more about contraception and make an appointment at Planned Parenthood, I'm likely to hear facts presented in a very different way from Catholic Family Services. That means that different emphasis and different worldviews make a difference to our presentation of facts, but we have to be alert to the given facts themselves. Would Planned Parenthood mention that some pills are abortifacient, for example? That's not a moral dilemma for their organisation, so why would they bring that fact up? It's a small example in some ways, but it's an area that has significant moral consequences, unknown to those who assume that all pills are truly contraceptive without inquiring further. Some women, for example, too, decide to donate their extra embryos after in vitro fertilization to be used for experimentation. But have they thought about what these actions are doing with human life? Or do they accept the current approach that an embryo is not to be regarded nor treated as a person? Do they ever consider the possibility that that's a very convenient theory for our being able to justify those actions? And even more directly, do many people question the Canadian definition of when is a person human, the answer being when you're completely delivered from the birth canal of your mother? Or even question why the definition of person varies from jurisdiction to jurisdiction, because there are different definitions of persons in different countries. There's surely something lacking when different societies cannot agree on something as fundamental to society as the definition of personhood, and there is clearly something to be gained for certain members of society if we accept particular versions. So for us, in terms of prudence, it means knowing the facts, knowing church teaching about the facts, assessing the means and consequences. Prudence demands reality. That demands a certain objectivity, a ridding of ourselves of bias or seeking self-advantage, an openness to what will happen and how it will be done. That's not easy, since the conclusions may take us in a different way from our desires and what we think are our needs. It's not just a mental capacity, but it involves a certain amount of self-surrender. The objective truth demands that of us. The virtue of prudence, therefore, demands the highest level possible of the capacity for objectivity, that is, the recognition of reality, integrated in the person's decision-making, not only in bioethics, of course, but in all areas of life. So the second cardinal virtue is justice. And so I have to ask the question, why is justice ranked second? Well, Aquinas taught that prudence is of the essence of every virtue, because an action must first be prudent before it can pertain to any other virtue. If an action does not conform to right reason, it can't conform to any other virtue. He said, that which is virtuous must first be prudent. Prudence belongs to the person. It's a personal characteristic that directs the person's actions and informs his or her way of being moral and of making decisions in bioethics and other areas. Justice, however, means seeing what is owed to another and to all other human beings. So justice is a relationship virtue which protects the individual in relationships with other individuals and with society. It means recognizing that each individual is, as the ancients said, given what is owed to him or to her. There is an element then of duty or obligation here that goes beyond personal reaction to a person. Whether or not I like him or her, whether or not I like specific nationalities, religions, ethnicities, that's irrelevant. Every person must have his or her due deserves, no more, no less. That is justice. Now, we, of course, are always inclined to think of love and charity, and we don't forget the theological virtues, which take us out of human limitations because we add mercy and forgiveness to our sense of justice. But that's not what's found in strictly legal justice, where the reality of a situation is reconstructed, reality again, the objective facts, and recompense or penalty established on that basis. If harm is done, it must be redressed. And there's also distributive justice, which guards the relationship between individuals and the state, where the state tries to achieve the best for the individual through promoting the common good. And it's in this realm that we can best see justice at play in bioethics in our types of healthcare systems. In countries such as Canada, the move towards universal health care was promoted as a justice issue. And it's clear this is one way in which society takes care of its citizens. Funded by individuals where that's possible, so each contributes as is proportionate to him or her through taxation, the state then provides for individuals as needed as a form of health insurance. And one thing we can be sure of is that each of us, will need that assistance at some point. But even before such schemes existed, most societies took care of the sick and disabled, perhaps out of a sense of charity, but also out of a sense of justice, because the common good depends on the strength of the citizens, and illness befalls people usually from no fault of their own. And it is, of course, a biblical imperative, the care of widows and orphans in the Old Testament, while Jesus' ministry can be construed very much so as the healing of people's souls and bodies. Justice issues in bioethics arise in our own society when we see people are not receiving what is due to them under our system. For example, regarding the provision of palliative care, it's been shown that people who live in remote areas are not as well provided for as those who live in urban areas. And this is unfortunate, but one of the problems for a universal system is that it cannot provide equal treatment where provision is not possible. Supply and demand are objective factors then that come into play. And we have to remember, I think, that universal does not mean equal, and even justice cannot demand that. People on reserves, for example, have a predicament, often having to travel great distances if, say, women have difficult pregnancies that are better managed in larger hospitals. So such people are disadvantaged compared with those who live in less remote areas. But again, this is a question of practicalities rather than true injustice. And prudence will illustrate how such situations can be coped with. If healthcare personnel, another problem, are not inclined to live and work in some areas, they can hardly be compelled to do so. And while advantages such as telemedicine and robotic surgery have made a great difference, I think this highlights the fact then that it's not necessarily injustice that's at work, but practicalities. To be truly unjust, there always has to be an element of unreasonableness. There are many problems today we could discuss about the allocation of scarce resources, and one immediate question for all of us is, should all of us be able to demand all the services we think are necessary? Are all surgeries and procedures necessary after a certain stage, not age, if our lives as our life and our health declines? Is there a time when we should say it's not worthwhile to pursue this after looking at the prognosis and the outcomes? Catholic teaching can guide us here because it encourages us to look at issues in that way. It asks us to be reasonable as far as our own health is concerned. Notions of justice aim at having us ask if it is right that everything should be done, just because it could be done. And we know, especially today, there are broader areas where justice is very much involved in some of our current policies about abortion and the possibility of euthanasia. And these are usually framed as questions of rights, a woman's right to choose, which ignores the status of the fetus, and now regarding the end of life, the right to die, which itself is an unreasonable phrase since everyone will die and there's no need of a right to do so. What is meant is a right to be killed, euthanasia, or to bring about one's own death through assisted suicide. And we are now to go along with the idea that these are to be achieved, demanded as a matter of justice. And so the very notion of that word is steadily being shaped in a different trajectory through an agenda that favours individual choices stated as rights, taking precedence over the common good. The question of one's exercise of conscience and religious freedom is increasingly being challenged in healthcare at the individual and institutional level. Attempts are being made to prevent physicians from refusing to comply in some areas or insisting that they refer patients to other doctors who will carry out the desired procedures. And I had written this before the most recent edict came out from the College of Physicians and Surgeons in Ontario, asking its members these very ideas, that the whole question that they're being asked to, if they will not actually treat a person, to refer them to another physician who will do the procedures that these very physicians are against. In other words, park your conscience at the door, as they say. And so this is the fourth attempt just in Ontario to do this. So it's not an abstract issue, it's very relevant, and especially for physicians at the moment. And of course this goes far beyond medicine even, but it highlights the whole question of justice in society. So it's an extremely important justice issue in that protection of individual conscience has always been a mainstay of individual and state relationship, as has been the right of institutions to declare, teach and practice their moral stance in the public square without impunity. So recognition of justice and injustice as a societal and relational virtue is increasingly, I think, a vital virtue for all of us as individuals to participate in as a community, not just for bioethics and healthcare, but for education, the family, and the freedom of the church itself. So the virtue that comes after prudence and justice is fortitude. And fortitude, again, is an inner characteristic having to do with our personal reactions to situations. So it's not objective in the sense that reason has to be. It's not looking primarily to the good of another or to the good of the community, as justice has to do. What makes us endure, or makes us strong in character, or makes us brave? Fortitude in the extreme is in some way connected with death, since it means, in its fullness, being ready to die for a cause. Martyrdom for Christ is the ultimate sign of bravery. The point, I think, is that the truly brave person doesn't suffer injury or evil for its own sake, but is looking to preserve a greater good. And so fortitude, although a cardinal virtue, is not the greatest virtue, for it points to something else. Then we realize that we have to be prudent and just before we can be brave. Fortitude becomes what it is through being informed by prudence. It has nothing to do with a reckless bravery, but is a possible sacrifice of self in accordance with reason. We have to do a correct evaluation of what one risks, as well as the good one hopes to preserve through that risk. Martyrdom being the greatest example of this, but so too is dying for any just cause. We've just honoured our dead on Remembrance Day, and when we do that, we're paying tribute to their fortitude. We realise that fortitude is based on prudence and justice together. In thinking recently of those who tended to those who fell ill from Ebola, especially in the early stages of the disease, I think we can see that the bravery there went far beyond the demands of justice and was more accurately, it still is, a supreme manifestation of charity too. And Cardinal Collins mentioned this point in his homily, that in a slightly different way, of course, but it's the same idea, that to be brave is not the same as having no fear. If I've lost the will to live, I may welcome death, but this is far removed from fortitude, which recognizes and attempts to maintain the natural order. Fortitude presumes we have a certain fear of evil, but we do not allow ourselves to be forced into accepting that evil because of the fear. If we face up to the cause of the fear and do not let ourselves be deterred from doing the right thing, then we show fortitude. We might call it strength, backbone, character, etc., but we recognize it when we see it. And fortitude also means being able to endure an evil, such as severe illness, a physical evil, but an evil nonetheless. In using the word enduring, Thomas Aquinas was clear that this is not a weak verb. Enduring comprises a strong activity of the soul, namely a vigorous grasping of and clinging to the good. And he went on to say, only from this stout-hearted activity can the strength to support the physical and spiritual suffering of injury and death be nourished. And he brings in the virtue of patience at this point. And by this he means that the suffering person, the patient suffering person, the true sense of the word patient, does not allow himself or herself to be made overly sorrowful or depressed by the circumstances. To be patient means to preserve cheerfulness and serenity of mind in spite of injuries that result for the realization of the good. He said, patience keeps the person from the danger that his or her spirit may be broken by grief and lose its greatness. And I've often seen in reading obituaries, for example, that after a person dies, it will be said, he or she suffered from an illness bravely borne. And I think this signals the virtue of fortitude. It's a very common virtue in the way many people handle their last days. There's also a type of what you might call spiritual fortitude, when we take the risk of letting go and letting God. And it's the opposite way of today's move to control not only our life but also our death through assisted suicide or euthanasia. We want to move away from control to trust. And I think, again, this is often seen when people make a decision to end treatments and put themselves in God's hands. I can only speculate about that. I've seen it in others. A patient waiting on God, not morbidly and not sadly, but actually pretty matter-of-factly. And I think that's fortitude too. So I'm coming to the last of the cardinal virtues, temperance, listed as the last of the four, yet clearly necessary for our ethics to be on the right track. So many movements have used this word, including anti-alcohol temperance societies. Aquinas spelled this virtue out for us, and his insistence elsewhere on proportionality bears out his meaning. Temperance means to dispose various parts into one unified and ordered whole. So he meant by this that the correct order of a thing means that any one part must not be given disproportionate attention. And this virtue revolves around the injunction to love God and love our neighbour as ourselves. And our tendency is to love ourselves most. And when we do that, we make gods out of other facets of our lives, whether food, alcohol, sex, career, reputation, and so on. Keeping these other facets in balance is challenging because none of them is inherently wrong. It's the emphasis on them that we frequently misplace. And so we have polar opposites of chastity, unchastity, continence, incontinence, humility, pride, mildness, uninhibited anger in the same person. On the one side, disciplined or being tempered, temperateness, and on the other, intemperance. When it comes to bioethics and the preservation of health and life, undue concentration on one's own self-preservation may be intemperate. Too much concern and self-limitation without cause may be as intemperate as the idolization of food. Both look to fulfilling needs beyond bodily needs. Some of the ways we occupy ourselves today may be instructive. Nominally, for health reasons, we sometimes pursue the body beautiful as an end in itself. Too many hours in the gym or not enough. Too rigid dieting to conform to cultural norms rather than for health reason. Extended cosmetic surgery to keep aging at bay. But how do we know when balanced self-love becomes selfish and therefore intemperate? I just think it's one of those things that we know but we choose to do. But I think Aquinas should have the last word. He says that another meaning of temperance is serenity of spirit. And this is achieved through everything within a person being in order. And in any of our somewhat mindless chasing after some of these other points reveals a certain disorder. To sum up, I hope we can see that the way we practice these habits, these virtues, does make a difference, not only to our own lives, but it also affects our neighbours and society. And I think we have shown fortitude and patience, and I think it would be prudent of me to stop now as a matter of justice and to avoid being intemperate. Oh, okay. I didn't think it was going to be a question and answer session. But if anybody has any questions, sure. Yes.
If you don't mind, I'm working as a social worker with folks who are drug addicted, prostitutes, and such. And so for me, what's foremost on my mind is this ethical dilemma, this idea of harm reduction. And I think there was one point at which our last book spoke about how it could be ethical for condom use in certain instances where already the act is immoral. I just wonder if you could speak to that in light of virtues.
Right. That's exactly what he did say. And it was in that sort of situation where people are already involved in that type of behavior. And so I'm assuming that what he would mean is that it's more reasonable to prevent further harm than, and he was presumably talking about AIDS and other sexually transmitted diseases, if somebody's already in that behavior, than to risk something that you would call even more unreasonable. That doesn't in any way, of course, condone the sexual behavior, but it does show, I think, how you have to apply that whole question of working out in these particular stances, these particular circumstances, what's really the best thing for the person involved. And it took that question, took many people by surprise, I think, not so much the question, but because it was probably posed pretty deliberately to him, but I think the way in which he answered it was, in my mind, quite Thomistic and definitely made sense in terms of preservation of life. Yes?
Can you speak to double-blind effect?
I'm sorry?
Just speak to double-blind effect, just to...
Double-blind effect?
Yeah, just...
I'm not sure exactly what you mean.
Just when it comes to, I guess I heard it in a moral ethics class, and we're talking about double-blind effect again in areas of Africa and things like that when it comes to abortion as well. And there was a case in Africa that involved a bishop and other things, and so we're basically teasing out the balance, so to speak, of objective and subjective and context and conscience.
Oh, okay. Well, I mean, I don't know if everybody heard the question. I'm not sure I can even rephrase it entirely because I'm not sure I actually understood it completely myself. Because you said double-blind effect, but not double effect. Are you talking about contraception?
Yes.
Only contraception?
That's the context that we were talking about. Yes.
Right. Okay. I really can't imagine how you could use the question of the principle of double effect in that area. When something is, I mean, the way the church would be saying it is definitely that contraception is objectively wrong in every circumstance. And then there would be people who would say on the pastoral side, it's very much a question of people's consciences and how they form it. But the objective teaching is something, it's just not an area you could use double effect in, unless I'm misunderstanding the circumstances you're specifically talking about. It just wouldn't apply. Because double effect is usually used when you know there will be an evil effect from the good that you're doing, but what you're doing has to be good in the first place, and therefore contraception can qualify. Okay, good. Okay, can I ask Father Chris to
Well, obviously Moira stole all the thunder. On behalf of the Newman Center, I'd like to thank Frank, Helen, Morneau for your continued support. It hasn't been just one day or 1 year or 10 years. It's been so long, and it's clear that your heart is here. And we're very grateful for your support here at the Newman Center. I want you to know that we're all very grateful for your work. And also that you have a share in the ministry that we do here in this community and also at the University of Toronto. You're always in our prayers. Thank you very much, and may God bless you. Thank you.
Thank you, Father Chris. And I would just like to echo that. We have been the beneficiaries of your generosity. And for that we are truly grateful, because it has certainly made our work possible in so many different ways, and that's so incredibly important. At least I certainly think it is, and I'm really glad that you think it is too. And besides that, I really admire you as parents, and I certainly envy your 11 grandchildren. So Helen, we'd like to present this to you, and just it's very, very, very interesting. Yes.
Your Eminence, Reverend Fathers, sisters, on behalf of Helen and myself, I wish to thank you for acknowledging our involvement here at Newman Center and with the Bioethics Institute. I can remember very well, many years ago, with Cardinal discussing the formation of the Bioethics Institute, and it has developed phenomenally well to the benefit of the church, not just here, but throughout Canada and elsewhere, and it's wonderful. I can remember the Newman Center, my goodness, I can remember it emphatically when I received a call one day, and it was from our spiritual chancellor at the diocese, and he asked if I had a few minutes, and I spent a few minutes on the telephone with him. He was having some difficulty with the Newman Center as it was structured many, many years ago. And we talked, and a few minutes later, he called back and he said, "Can you take a couple hours this evening and come with me to try to assist in handling a meeting with two debating law firms?" And I said, "Well, that's near impossible. Number one, I haven't been involved in Newman Center at that stage other than dances many, many years prior to that." But I said, as I thought about it, I said, well, if His Eminence would allow me to speak on his behalf in a difficult situation like that, I would be prepared to assist you. The Monsignor said, "That's not possible." I said, "Well, maybe in this instance you better ask him." And he came back and said, "The Cardinal has stated that he would like you to assist in this regard." We were able to resolve the problems. And the next day, the Cardinal asked if I would end up being the chairman. And then Helen became mother of the board, as Father Mazika used to say. And we were here with regularity with Father Mazika and then with Father Pat O'Day himself being a wonderful man for a long period of time. And this is part of our heart, if you will. So thank you.
Yeah.